Today is our first episode and we have a very special guest, Prashant Tandon, who is the founder and CEO of Tata 1mg app.
Where do you want me to start?
From the beginning, let's start from the beginning.
Put out an app that creates awareness. We put it out. That was around the time the Satyamel Jayate episode also happened with Amir Khan.
Yeah.
Great combination of things coming together, and this app became India's largest health app. Health Card had at that time around 25,000 downloads, and this thing in one day we had 300,000 downloads.
Let's talk about the artificial intelligence in healthcare.
Seen that Gartner curve for any technology. This is the height of inflated expectations. Then it falls into a valley of where everybody gives up on it, and then it comes to a stable plateau. So AI part is at the hype part, validates the interest in healthcare is very, very strong. Macro bet for the next 20, 30, 40 years. Healthcare is only going to grow from where we are.
Why did you take the hard call of doing the diagnostic business entirely on your own?
We really wanted to solve the quality problem. Anywhere from 5 to 25, 30% of medicines in the country, they put in the NSQ category, which is not of standard quality. Now that's scary high. The only way we could assure that, at least to our customers, that you're getting a genuine medicine is if you are buying directly from pharma. What is the big challenge in healthcare is that there are too many shortcuts. A big part of this ecosystem is what is called the sync test. It's reasonably large scale issue, and it's obviously very high gross margin. You just have to print paper. Tata 1mg, I cannot have anybody tarnish the reputation of this brand.
Hi viewers, I'm Vivek Sinha, the founder and CEO of Emversity, and I welcome you all to this healthcare-focused podcast series, The Prognosis. So the idea behind launching this podcast was to help create next generation of leaders for the healthcare industry. And we thought, what could be a better way to do this than let leaders of today groom leaders of tomorrow? So in each episode in the podcast, we'll be talking to a top CEO or an entrepreneur from the healthcare industry. So if you are an industry professional or a clinician or an entrepreneur building for the healthcare industry, then this podcast is for you. This podcast is brought to you by the Emversity team. We are a training and recruitment platform for the healthcare industry. We do two things in service of our mission, which is to address the global shortage of doctors, nurses, and allied healthcare workers. First, we run work-integrated degrees and diploma programs, which are curated along with the top healthcare companies and NACA plus universities. And second, we also run an online jobs marketplace called Resume with an RX. Now, Resume is a portal which is a 10 times smarter way of getting hired by a top healthcare company in India. All right, let's dive right in. Welcome to the podcast, Prashant. We'll be very interested to understand your journey, the experiences that shaped you in your formative year, and of course, your professional journey as well.
Looking forward to the conversation.
Please take us through your journey, Prashant.
Where do you want me to start?
From the beginning. Let's start from the beginning.
Chalo, I grew up in Delhi, West Delhi. School was here, college was here, went to IIT Delhi. Post IIT, I joined Unilever, and they have a business leadership program. So that was my first role. It's a cross-country, cross-functional, a very good development program. So post which I was given my first job, which was a production manager at a soap factory in a place called Chiploon.
Wow.
So that's right midway from Bombay to Goa, neither here nor there. But it was a great learning experience, one must say. And it was a factory which was going through union negotiations and a lot of turmoil, so to speak. So got to see and engage in a lot of things that many people don't get to see through their lifetime. It was just a very intense phase, but a very formative and I think a foundational phase for me. Post that, I was in the brand team for Lux, where I joined as the junior guy for India. Then we had a bunch of restructure, and the two of us became the two guys for Asia for product development, and the senior guy quit, so I ended up shouldering that responsibility. So I had a great time, 13 countries for what was Unilever's largest brand in the region. So I had a great time at Unilever, and then 2005 went to the US to do my MBA at Stanford. Stanford again, that was my first exposure to entrepreneurship and what that world looked like. Till that time, I was very, very happy to work for an MNC and build my career as a global executive, maybe running one of the large global companies one day. That was kind of how I was wired. But post Stanford, it was like, okay, I really need to get and build something of my own. And But by the time I graduated, I had almost no clue what to do. Got an opportunity to spend some time with MapMy India. So I was there when we launched the first GPS navigation device. Now that company is doing brilliantly, so very happy to see that. I spent 4 months, just did the launch with the team there, went back to the US with McKinsey, and spent 2 years with McKinsey out of San Francisco. Now, San Francisco, McKinsey, that was my first brush with healthcare. Until that time, I had never experienced healthcare, thankfully not too much as a patient either, but definitely not academically or professionally. So at McKinsey, I started consulting for healthcare companies. So pharma companies, medical device, healthcare services, all that stuff. This was during the financial crisis. The good of that was that the projects were actually meaty. People did not have money to waste on sidey projects. So it was, if they have real work, they'll get us in. And so got to spend a good 2 years there with McKinsey before finally taking the plunge, coming back 2009. Samir and I came back. Our first venture was called Health Chakra. That was a practice management software solution for doctors back in 2009. Spent a decent year and a half at it before pivoting to a direct-to-consumer model. That was HealthCart. March 2011, we launched HealthCart. And from within HealthCart, there was a division that we incubated. It was called HealthCart Plus at that time. It was looking very interesting. We got fascinated by it. In 2015, spun it out. That's what became 1MG. So that's the journey. 2015 onwards, it's been 1MG.
Wow.
People should start whenever they feel ready to start. And that feeling ready is kind of very individual. There's no reason to go through or feel that you have a cushion. That cushion may not be real anyway. It was just, I felt it could be overconfidence also. But I think when people feel that, okay, this is what I need to do right now, and I know that there's something I want to pursue, that's the right time. Of course, they should be a little practical about it, whether test their hypothesis, whether they are ready for it. But if that is so, if there's a backup social ecosystem, family, that things are aligned, and you feel mentally this is what you need to do, want to do, go for it. See, entrepreneurship almost always is it's not the logical kind of mathematically probability-wise, it is not high probability of success. So you're taking a punt. So take it when you are ready, when you feel that is the only thing that really you want to do. One life, try out whatever you want to do. Assuming that you're not foolhardy about it, just be ready about it.
Let's zoom into 2014-15. So you said that Tata, what now we know as 1MG, it started as a pilot within the larger business. What was the initial thesis behind starting it? And at what point of time you realized that it could be so big so as to warrant your entire time?
Yeah, so I think it was a bunch of, what was happening was the dots were getting connected when I look at it now. 2009 when we came in, what was the fundamental thesis? The fundamental thesis was that the healthcare system in India will get digitized over a period of time. Foundational technology will come in place. All the benefits of medical records, data analytics, everything that healthcare has been talking about but not seen in India. Early stages of that, US, that part had just started happening or taken off. So we felt India will see that journey begin. And once that happens, the only thing was our hypothesis was that journey will begin by digitizing the doctor's clinic. And once we have a software in the doctor's clinic, all that data will start flowing and we'll do all the wonderful things from there, blah, blah. There's a big plan around it. Now, when we realize that, okay, the Indian market per se is actually and the right model for healthcare. I think that was the most important learning for us, that almost everyone everywhere in the world designs healthcare with either the provider at the center, the doctor or the hospital, or the insurance company at the center. Nobody designs it with the patient at the center. And in the Indian context, healthcare was becoming more and more that way, consumer-centric, patient-centric retail, because the payer was the patient. And the journey that the patient was going through, there's a massive transformation happening from a situation where they would go without any context. Now patients were going all over Google, you're trying to read about what's going on. The trust deficit with the system was going up. So patients were researching more and more, and actually doctors were getting annoyed also that everyone comes as a Google doctor. But the reality was there was a genuine pain that the patients were facing. And we felt that consumer healthcare is going to be the future. Our patient-centric healthcare is going to be the future. So just coming back to this, digitization was going to happen. All the data analytics and all that should have happened. Our model moved to direct-to-consumer with health cart, starting with broader consumer health products, nutrition supplements, baby products, bunch of things, bunch of categories we had. Then came Health Cart Plus, which actually also came from, which was a byproduct of Health Chakra, in the sense that during Health Chakra, we created what was the first digital database of medicines in the country. So we digitized, people sat, data entry, all medicines, all salts, how to use, how not to use, what prices, substitutes, generics. We made that full database to aid the doctor.
Oh, that was done during the digital Chakra time.
2009, 2010, the doctors never used it. But then we had this database lying, and just when the app ecosystem in India was happening around 2012, 2013, we felt, okay, we have something very useful that for us it was a eureka thing that when we came to do the digitization, that for the same salt you have like 200 different brands selling the same salt at vastly different prices. And to me it was an indication that the market was not working in healthcare. It was a broken market. If you look at the US, there's a brand, and then the retailer, a CVS or a Walgreens will have their generic. Indian market, 200 brands, all trying to sell the same generic and vastly different prices. And in many cases, the multinational pharma brands are priced way lower than the Indian brands, which may be market leaders. So there's no necessarily a quality and price kind of a comparison. But for patients, there was an awareness gap. They just did not know that, okay, this medicine from this company is same as this medicine from another company. And on their chronic medication, you could save 40-50% easy. On any medicine, if you look up on 1 mg, you'll find a brand you can trust and you can save 40-50%. So we thought, okay, let's at least put it out there, put out an app that creates awareness. We put it out. That was around the time the Satyamel Jayate episode also happened with Amir Khan. Yeah. Suddenly it was like a great combination of things coming together, and this app became India's largest health app almost overnight. Over 3 days, Health Cart had at that time around 25,000 downloads, probably early stages. Practo was further lower. And this thing, in 1 day, we had 300,000 downloads. So then what we saw was, in 2014, around 1.5 million downloads when Health Cart was at 50,000. Other players were 30, 20, 40,000. This was 1.5 million downloads with not a single penny spent on marketing.
This was mostly to consume the content.
Pure content. And we're like, okay, something is going on. This ecosystem is responding well. People are looking for this information and they are trusting the information, us as the source. Now, can we go back and build whatever we thought we would build and left in 2010? Can we come back to it, which is digitize this ecosystem now with the patient at the center? Because one of our key learnings actually in that doctor-centric model was some doctors you will digitize, but a patient goes to 5-6 doctors, and at the end of the day, the Indian model is the patient carries a file.
Yeah.
And that file is what he's supposed to carry everywhere. So if you digitize a patient, that's when you get the full context of that patient. And then if that context is relevant to a doctor, the doctor will naturally adopt that. So we thought, okay, we were probably holding this thing the wrong way. Now let's go with the patient, because now the patients are coming and reading about their medication. We started offering medicines. They started giving us their prescriptions. We started getting more and more of their records coming in. And we're like, okay, now we have whatever we wanted to create, or we believed India will see, a digitized healthcare ecosystem. Maybe this is going to be the vehicle. And we create an integrated healthcare play, because it was a serious enough platform. It's not a casual platform where people will come for time pass. And month on month, we were seeing engagement rise. So many people reading about medicines, asking us why can't we buy. So we started a marketplace for medicines. Very soon, those prescriptions, the other thing that was there was diagnostics. So we started a marketplace for labs. And third thing was that, okay, can people just even get their telemedicine or consultations? So by 2016, we had all these things together on the platform. We were known more for the pharmacy, but we had the initial view was we'll create an integrated healthcare platform. The idea was back from 2009 that we'll digitize and get that data context of a patient, start trying to get these disease trajectories and figuring out inflection points, where to intervene. That is the exciting part, that we were way ahead of reality in our thinking at that time. But now all those things have come together: technology, data sciences, AI, digitization, everything has just picked up so beautifully. So now we are seeing that happen.
So somewhere in 2015, you realized that the idea which you initially wanted to pursue in 2009, that the right time for the idea had come.
And in my learning about healthcare is that it just takes a lot more time than people think it will, because it's multi-stakeholder ecosystem. It's a lot of things that have to move. It's a lot of behavioral change. Mostly nobody wants to engage with healthcare. They want to look the other way unless they have no other option. Behavioral change is very, very hard when you yourself want to change the behavior. So, for example, if you want to lose weight, and very simple, eat well, exercise and all the good stuff. Now, it's very hard to do when you come to the reality of it. When you don't want to do, then driving a behavioral change is really, really hard. And so driving a behavioral change of doctors to, instead of writing on the paper, to start typing it in or using a pad or all of that, extremely, extremely hard. We are still hoping it will happen sometime soon, but very hard. Similarly, changing behavior of patients is very, very hard. There are people get very, very stuck in certain ways of living, and it's working for them. So now when we are creating solutions, we are creating solutions that make life better without changing the behavior. So for example, we are again trying to digitize the doctor's clinic, but now our approach is doctors should just write whatever they write, click a picture, send it to us through AI and our systems of human-assisted AI. Those get digitized anyway. Because how did we learn that? Because we do it for our pharmacy. We get prescriptions, we digitize it super fast. So those are the kind of, I think, more real solutions that are now coming up. So that's what keeping us super excited now.
Amazing. And if we talk about this integrated health platform, in its current avatar, I book doctor's appointment, I also get my diagnostic test, whatever the doctor prescribes, and I order the medicine. Are these three the main line of business, or is there something else?
See, in the outpatient setting, what do patients need? They need, firstly, it's still information. They need to know what's going on. Medicines, lab tests, consultations. Typically consultations first, and then lab tests, then another consultation, and then medicines. That's kind of the way this system works. And then allied healthcare services. Those allied healthcare services could be a dietitian, nutritionist, could be a physiotherapist, could be some healthcare at home attendant. So some of these, the medicines, lab tests, consultations, and the long-term models of care we want to provide ourselves. Everything else we partner with the rest of the ecosystem. So we do have these care plans which have, and both direct to consumer as well as institutional. We work with the insurance companies, corporates, we work with pharma companies, hospitals, whoever wants to connect with their patient to deliver a healthcare service at their doorstep. We have a solution for that. So that's essentially what we do at the end of the day.
Got it. On the pharmacy side of the business, are you a rollover or an aggregator of local pharmacies, or when I order from the 1mg app, it gets directly delivered from here?
So now it's pretty much we are inventory model. It's our own warehouses. We buy directly from over 400 pharma companies, and there's a reason we started as a marketplace, and started as a hyper local marketplace. But then as demand grows, it's very hard for a small retailer to cater to the kind of scale and service that we needed to give. And what we were solving was the convenience problem at that point. But as we grew, we figured, okay, now let's work with the larger distributors, because working capital required to run a business of a scale that we are going to operate, unfortunately, where we have to move up and up. Then once that basic access problem was taken care of, we really wanted to solve the quality problem and authenticity problem. And that problem is very, very close to my heart. I'm very worried that the areas that we need to, we may not be paying enough attention as an ecosystem to. Just a few things. Reports, again, always debated, but anywhere from 5 to 25, 30% of medicines in the country, depending on which agency publishes the report, they put in the NSQ category, which is not of standard quality. Now that's scary high. Even to me, 5% is scary high, which is at the base level. Now, what happens is this ecosystem, unfortunately, we don't have end-to-end barcoding. We cannot, as a user, you cannot authenticate a medicine that this is genuine. Okay. So you have to go with trust. Now, the only way we could assure that, at least to our customers, that you are getting a genuine medicine is if you are buying directly from pharma. Because what happens in the supply chain is you have a lot of these markets in many cities, in Delhi also, Bhagirath and around. What happens is medicines from various sources come and mix together. Oh. So they're like, and it's never somebody's it doesn't have to be fake. It's just that it's not quality. There's an entire unfortunate ecosystem people talk about where people with acetone clean the expiry and stamp it again and put it back in the market. 45,000 warehouses in the country. Room temperature is also supposed to be 25 to 30 degrees. I don't think more than 500 warehouses are air conditioned in this country. Now, summers are 45, 50 degrees. I don't know how long medicines have been stored. Even it's not that a retailer would knowingly buy from a source that is giving, people may not even know that the quality is, or it may be an issue. For me, the only way to solve that for my customers at least was I'll buy direct. So now, to your long answer to your short question, we buy everything direct and we sell everything direct to them.
There's also a value angle to it. I mean, I have personally experienced that when I order things from the 1mg app, it's usually I get it cheaper compared to my local pharmacist. If you are just a marketplace, you are adding a distribution layer on top of the existing channel.
Yeah.
So there's no way you can, unless you bleed, they can't.
No, I'll tell you two parts to it. One part, I might actually be able to have higher margin if I was buying off the grey market. Just to, I could do that. And from the very beginning, I was very clear about that. So margin discounts at the retail end are market dependent and competition dependent. But at the back end, we put that as one of the core things. We'll not take a shortcut and buy from any sketchy distributors or channels. We'll only work with distributors that are authorized, so to minimize our risk. And I think still, I hope soon we will have end-to-end barcoding and authentication of where each medicine has come from. Till then, it's a game of trust, and I want to make sure that customers who trust me, they are going to get a genuine medicine. And in India, a lot of us talk anecdotally that sometimes the medicine works, sometimes it doesn't. And there are so many factors. It may not be the medicine at fault, but it might be. And so that's the thing. You can. So to me, it's very important that the front-end pricing is what market determines. The back-end supply chain margins, of course, it's much better if you have the end-to-end margins. But then when we see that you can get 10-15% more margins buying from random sources, you just have to make sure as a company you don't allow that temptation to creep in purchasing teams to just increase their margins that way.
And we'll come to the diagnostic business where of course you are the provider. But in the pharmacy business, essentially you are a retailer commanding obscene volume. Here your margin profile and the unit economics, it will be very similar to the e-commerce models, right? Even the challenges, because there's a behavior change involved, in which also means that these models, the e-pharmacy model, will it also be a winners take all or two winners take the whole market kind of a market, requiring sustained investments over a very long period of time?
See, I think we are, first of all, you mentioned obscene scale. We are not, I don't think we are obscene scale yet. All said and done, we are not even 1% of this market. Wow. And the entire organized market, which is online as well as the brick and mortar chains, combined are not even 10% of this market. So while a few players look at that they've reached decent scale, there's a very, very large market out there.
So at 1,000 crore plus, you are just not even 1%.
Not even 1%.
Okay.
Not even 1%. So we are scratching the surface in that sense.
What would be the revenue of the pharma sector in India?
I think around 150,000 crore at least, could be around 200 to 250 also. It gets mixed up because how much of the numbers reported for India are getting exported, one doesn't have I don't have a full eye. But we are talking, give or take, I would say $25 billion.
Wow.
So 200,000 crores. So at our scale, we are just tiny. We are barely there from the scale of the opportunity. Having said that, in the organized market, we are one of the more relevant players today. And that market is growing reasonably well. And we expect that the next phase, as I said, from our journey also, first we were solving the access and convenience standard e-commerce issues. What is different in health is the quality angle. And now as we have built our muscle so that now we can stand by and say that, okay, we assure you of the authenticity. That is when I think the margin equation and also the scale of the game can change to the next level. So we have to get more value added in what we offer. But yeah.
So there's an incumbent behavior or a status quo wherein you order medicine from your regular pharmacy, the guy delivers in 30 minutes. If a certain medicine is not available, you call your doctor and the doctor gives you an alternative, or in some cases the pharmacist himself gives you some alternative.
Yep.
Or let's say the value offered, the convenience was so dramatic that the behavior change was not an issue for you.
No, so I think we benefited a lot from a behavioral change happening in the ecosystem thanks to general e-commerce. I'll be very honest about that. A lot of people, absolutely same question for grocery.
Yeah.
And before that for everything else, but it's not an experiential purchase. You go because there's a need. If you don't have to go, for many people who it's not. And in pharmacy, unlike grocery, you don't even have to make a choice. You don't have to say like Bon biscuits versus Good Day versus this. I want to see 3-4 before I make my purchase. You don't. So it's actually one of those where you just need to get it done. And you get it done where you feel comfortable that it will get done. So the challenge was not about people trying us out that way, but people getting confidence that we'll deliver same day. It used to take first wave, it used to take 2 days, 3 days to get the medicine. Then now we deliver it the same day. So that part of the behavioral change we benefit. The other big alpha in our industry was COVID. The government allowed only like 4 sectors that could operate, and one of them was e-pharmacy. And we were called upon to deliver medicines at home when it was, and of course people didn't want to go to a pharmacy. So we had it almost infinite. The challenge was ability to serve. And a lot more people got a flavor of trying it out, that it actually works. When we place an order, somebody does come home and deliver those medicines. It's pretty seamless. So those things I think really helped us in our journey. And it's a game of like 2015 to 24, a lot of compounding of the entire ecosystem has come together. This is the last category probably coming online, and we've benefited from a lot of money spent and behavioral change sponsored by the rest of the players. Yeah. And then COVID actually genuinely changed how people look at this industry.
Yeah. You said that you are already able to achieve same-day delivery now. Do you think the quick commerce narrative of 10-minute delivery for delivery of medicines is relevant? I'm asking this question because the way a regular pharmacist make money is actually through chronic diseases, ABCD, arthritis, blood pressure, cardiac, and diabetes. That's where they actually make money.
Yeah.
So my parents were, they were both diabetic, and they had an offline equivalent of your care plan. कि अगर आप diabetic हो हमारे यहाँ इंजेक्शन लेते हो, we'll give you a 10% discount.
Correct.
What we have already mimicked. Beyond that one-day delivery, the time and resources that you will spend, let's say if you, or somebody will spend chasing that 15-minute delivery, does it have a incremental ROI?
It does actually. I think two parts. One is the consumer need. So medicines, when you look at it, there is chronic and then there is acute and symptomatic. Chronic is around 40% of the industry.
So that's sort of a planned purchase, right?
That is, chronic is a planned purchase mostly. Many people in India still order, they realize they need to order when they run out actually, but it is still a planned purchase for the most part. Acute and symptomatic, you need it when you need it. So one part of it is, if it is available in, if not 10 minutes, the local chemists also 30 to 60 minutes, they do deliver. That's a very real service. So for that, people are much willing to do that. And I'll give you an example. Now, we have set up retail stores, brick and mortar retail stores, our first 50. A bunch of them are in Gurgaon. So in Gurgaon, from the retail stores, we do quick commerce.
Okay.
So we do 30-minute, 60-minute deliveries. And the response has been fantastic. So yes, people have appreciated that there is this greater confidence that they are getting their medicines sold. Now, we did not see a big delta between a 60 to 30 minute in that sense. So I don't know if 30 to 10 is a sudden jump or not. I don't expect it to be too much. But the other part of the game is actually important, which is the business model question. The business model with chronic is very straightforward. Ticket size is high, basket is big. The nature of acute and symptomatic is you need just that right now, and you're not going to spend your time trying to make a assortment of things that, so if you have diarrhea and you need an Imodium, you're not going to think that, okay, if to get my cart above 500, I should do this, that. So you'll order that, or a Crocin, Disprin, whatever you need, like 30, 40 rupee tablets.
And you also don't know whether the consumer is coming back or not.
Yeah, you don't know, but I think, and the consumer is also, in that sense, in a very, very just get it done kind of state of mind. Now, that is what is yet to be seen or tested, whether the economic model, whether that same consumer, what will they pay a delivery charge that comes with it? Will that be feasible? So my view of this is that in the long run, this is all feasible if it is replicating the local store model. So when you have a brick and mortar store in your neighborhood, just like that neighborhood chemist, he has a person who comes and delivers to you when you need it. The world is moving towards omni-channel, and that's what we are also gearing up for. So we've, of course, started the pilot in Gurgaon, and as I said, the model works much better than those dark store models. Dark store models in this category, to me, is an economic problem. It's very hard to make sense of, just because of ticket sizes. They do fall down, and tail model in pharmacy is actually so
because of the walk-in revenue.
Yeah,
these stores are all company-owned, company-operated stores. So far, you lease out the premises. Okay. What was the genesis behind opening offline store?
See, omni-channel is a reality. And again, as I said, all said and done, the entire e-pharmacy is like 3.54% of the market. 96% of the market is brick and mortar. Now, as our aspirations changed and grew, we are probably the third largest pharmacy player in the country after Apollo and MedPlus. If the intention is to be one of the or the largest player, you have to go brick and mortar as well. And the user demand is very clearly going in that direction, that they expect you online, offline, omni-channel, and as I said, our Gurgaon pilot, if anything, is just underlining or validating that. Business model wise, it's a to me, at least, it seems a more feasible business model than a dark store kind of a business model.
Sure. And Prashant, continuing on offline, while offline doesn't deliver the same convenience of online medicine ordering, but the authenticity, which was a pain point or a point of friction, that's still true, right? It still solves for that authenticity part. If I'm buying from a Tata 1mg store, I can at least be reassured that
I'll say if you're buying from Tata 1mg online also, you get the same medicine. But offline for a user is much more a physical experience that they're used to for a lot of users. As I said, 4% of the market is online, 96% is offline. So, and offline actually is, after a certain scale, it's also your marketing. People see that store and brand.
Yeah.
And so it turns out that customer acquisition through physical marketing at one point becomes competitive with the digital spends. So I think all said and done, offline, there are multiple reasons, but and there are certain customers who just get more comfort and confidence that they see a physical location also, even though they still may ask the physical location to deliver at home. So there's just, I think, user behavior, as I said, it will take its time to change, but authenticity, at least in our setup, online, offline, same medicines. Having said that, the way users view it might be a little different.
So on that note, Mithun of Carrot Lane once told me that whenever he opens a new store in a geolocation, the online orders from that geolocation also starts going up.
Exactly.
Have you started seeing those sort of green?
Exactly. That's exactly what I was saying, that people may see the store offline, get confidence to just call and place an order or go to the app and place the order just because it's naturally comforting to them. It's a behavior. So, totally.
Let's come to the diagnostic business,
Sure.
Prashant. And while we were talking offline, you told me that you own the end-to-end supply chain in a diagnostic business. It would have been tempting and really easy for you to actually build a rollover over existing diagnostic chains. Let's say do some bit of standardization, use their current infra. Why did you take the hard call of doing the diagnostic business entirely on your own?
So I think evolution has been organic. It's been very much first principles. And see, we don't come from running this industry for decades ourselves. So we have, I really believe that if I were to create value in an acquisition or even go franchisee or anything, I need to learn that business myself first. And I need to have end-to-end comfort and confidence. More than anything, I need to know what are the loopholes that people are going to otherwise take advantage of, and is it worth it? To me, the single most important asset I have is my brand. Tata 1mg, I cannot have anybody tarnish the reputation of this brand. So if I were to go and into a setup that I am not fully understanding, and to understand, I just have to immerse myself in it. So for us, it was very important that first let's set up a bunch of labs and see and learn. There is certainly it's so much easier with a brand like ours. If I say that I want a franchisee in 1,000 cities, I'll get in 1,000 cities overnight. Yeah. People would love to have a 1mg franchisee today. The Tata 1mg, of course, we get applications from all over. The only thing is, what is the big challenge in healthcare is that there are too many shortcuts. And as we saw in diagnostics, when we look at it, what's the single most important issue of the industry? Again, consumers may or may not be aware of it, but a big part of this ecosystem is what is called the sink test. You take your blood, throw it in the sink, print a report and give it to the consumer. Nothing happens. And it's reasonably large scale issue, and it's obviously very high gross margin. You just have to print paper. And these shortcuts are something we need to be very, very sure that we have enough systems in place that if we have any partners in the ecosystem. So for us, all these things are very, very critically important. Now, when we set up the labs from ground up, one, you can get all the latest equipment. Being the kind of player that we are. We got all the support from the big manufacturers, Siemens, Abbott. We worked with both of them. We got obviously good deals. We got to understand the entire value chain. What are the economics of this chain? And all our labs, I think, can very proudly say that all our labs are NABL certified, accredited. Not too many organized players also have that situation. Yeah. So while it is contained, it is high quality. Our reference lab in Delhi, that's CAP, which is the College of American Pathologists, certified or accredited to them. Now, they just published the course. So we are well above the global average and much above the big respected peers in our industry. India has only 12, 13 CAP accredited labs, not too many. When you see the ratings, we scored 99.4, global average was 98.7, and the rest of the Indian labs were below the global average. So that's where I think, to me, that is possible only if I have this absolute red line that nothing is more important than the quality of the services and products that we deliver. And we recognize we are competing against players who have been delivering great quality over a long period of time. So I have to deliver 2 degrees even higher than them. So to me, that paranoia, you can say, of quality has been a very important force. So till I understand it end to end, and when I say I mean my team actually, because they are the ones who will operate and deliver on it. I don't want to get into a franchisee or a business partner. And economics is an important part. If I cannot understand how this economic model works, I cannot bring in a franchisee to lose money. If the franchisee lose money, he'll cut corners.
Yeah.
So I have to have a business model that is very, very clear for everyone. Now, thankfully, my part of the business model now is working beautifully. So it's profitable, it's high quality, it's growing nicely, decently. Now we'll start experimenting. Is there a leveraged model to grow faster? So it's a little bit about just, I believe there is no shortcut to growing through compounding of learning. And I think we've built our company that way. We've been a little cautious, if anything. We can be guilty of going slow, but we are a little kind of conservative in our approach.
It's really impressive that your team had the maturity to take the right call between, let's say, growing fast. Because initially going full stack means it sucks capital. You could have had 10x the more number of labs with the same amount of capital invested.
Yeah.
Had you gone in a, let's say, shallow standardization or aggregation mode.
Yeah.
But long term, as you rightly said, your biggest asset is your brand.
See, long term, all these businesses real businesses are built on compounding of good work, efficiency. Just keep getting better. Learn, expand, grow. You can't outgrow the reality of the market that you operate in. You shouldn't try too hard. Basic principles in place, because it's always a marathon. It's at least I haven't, both at HealthCart and 1mg, what we've seen is it took its time, but at the end of it, both companies today at 30% market share, market leadership in the space we operate, good, strong economics. I think all of that has just happened by sticking to doing it the right way, and just if you keep getting better, after a few years you see how far you've come.
It feels special ना जब हम काम सीखते हैं और सीखते सीखते कमाते भी हैं. Earn while you learn with Emversity's work integrated degrees in allied health sciences. It's time to make your degree smart.
Amazing. So even your specialty test on the app, everything is done in-house. Nothing is outsourced.
What is outsourced is clearly shown to the consumers. Our cancer tests we don't do. Okay. So cancer tests we are partnered. We actually have the largest array of cancer partners. So MedGenome, Core, Datar, one of the Tata medical centers lab will come on board. Haystack. We've got a bunch of high quality players. So all of them. So, but then the user knows who they are booking with, what they are booking with them. Then it flows to.
And during COVID, there was a forced change in consumer behavior.
Oh, yeah.
Nobody wanted to go to labs. Post-COVID, how have you seen that? Had consumer behavior gone back to what it was pre-COVID, or has it partially gone back, or is it still the same?
The behavior doesn't go back. I think those who figured how to place an order online and experienced how good the service is, especially those who had a good experience, they stick. They may not need the test that often. In diagnostics, again, COVID was a 20-year, 25-year-old, 18-year-old, everybody will get a COVID test. Of those, not everyone will keep getting their all kinds of tests many times a year. But the right cohort for us would be typically the 40 plus. That cohort has been fairly active since COVID. Convenience is again one part of it. There's the COVID also taught people safety is another part of it. If you have say a fever right now, dengue and all these virals out there, so many people are coming to us to get their test done at home, because what's the alternative? You go to a lab. Lab is where all other patients who are also feeling the same, some of them genuinely sick, are also there. Even if you went without an infection, chances are you will come back with one. It's just better to have it in the contained, safe environment of your residence. Let the person come, mask, this, that, proper. So it's a safer method. It's a more convenient method. You don't need to wait. For most of the preventative packages, people have realized going out and sitting in a lab when you are fasting, waiting for your turn, so much easier. You're sitting at home, you say 8 a.m., the guy comes at 8 a.m., takes your blood, gone, have your morning tea. It's just, once they know that this thing actually works. That was their biggest question, that I placed the order, will anyone show up? COVID actually showed them that people do show up, it works, and they get their reports also nicely. And I think now the behavior is fairly set.
Let's come to the third piece of the business, which is consultation.
Yeah.
The way you went full stack in the other two businesses, standardize every element of the operating of the business. How do you standardize a service or a consultation?
So the consultation is still, I think, one of those things where you are largely dependent on the quality of the doctors that you have on your platform. Because at the end of the day, it's a professional relationship between a doctor and a patient, and we cannot intervene in the actual professional part of that relationship. So that's a little challenging, because in some ways the telemedicine guidelines are also very clear on what we can and cannot do about it. So we have to go with consumer ratings. Now the new set of guidelines say consumers can't give ratings on doctor consultation. So that part is one of those where we are still trying to work it out as to how do we give the comfort and confidence of a quality in telemedicine, because for a user that has been a big question, primarily also because you're getting consultations for as low as 30 rupees to 2,000 rupees. Now, what's the quality that you can expect from those consultations in the absence of us kind of setting up a full stack model ourselves, which we have not done for consultations? I think we still, that's a work in progress for the most part.
The new age startups and all these online ventures, they have received a lot of flags from industry body or from the incumbent players about a host of things. In pharmacy, for example, while the medicine getting delivered is as a standard SKU, but there were concerns about somebody calling to confirm the order and trying to either upsell or sell a different variant of the same medicine in order to command a higher margin. On the diagnostic side, the major issue is on the authenticity of the test, as you also mentioned. There's a transportation time if it goes beyond a certain limit. That has actually put sort of a question mark in the minds of let's say a regular consumer, especially more on the diagnostic side, I would say.
Sure.
How do you look at it? What's your take on it? How do you see things changing?
See, I'll tell you. Firstly, in any sector, there are highest quality, medium quality, low quality, all kinds of players. Now, and when we talk of an offline pharmacy and the things that happen there, prescription, this, that, we all know how it operates. In the online part of the world, there are players who would have a more aggressive style of functioning. There are players who will have a more conservative style of functioning. The good news is that the regulators are fairly on top of these things, and just like in e-commerce, there also telemedicine guidelines just came. As I mentioned, they are updating those guidelines because the concern, the kinds that you are mentioned, they took cognizance of that basically. They are trying to respond to with solutions that are feasible. At the end of the day, a doctor that's a professional who is regulated by the National Medical Council. So the National Medical Council came up with the telemedicine guidelines and regulation, and now they are coming up with a updated draft based on the learning. So it's a feedback loop. It's an industry in its infancy.
Sure.
So, and as I said, they will have great players, you'll have below average players, and then the regulators, their main job is to make sure that the bar keeps going up, and the good players is what everyone should strive to be like. Now, on diagnostics, you mentioned, diagnostics, there are a few tests that require very clear that it needs to go into the machine within this time frame and all that. That apart, those tests we don't do at home actually. It has to be done in the doctor's clinic or in the lab. Other than that, I'll tell you, the big reality of the diagnostics business is the machines are so sophisticated today. If your sample is actually spoiled, the machine's rejected. So as long as you can get the sample with the right barcode, centrifuged, stabilized, there's no problem. For the longest time, all the big players also operated with one central lab, one reference lab, and then from all satellite areas. I think Thyrocare, when they started, they had one Mumbai lab, and from all India samples would fly in. Lal had a regional structure that way. Now, transport is not the problem. It's just that, people want faster reports, so it's better to have labs closer to where the patients are. The stability is maintained through enough processes and systems. And as I said, all of these are also processes and systems that if you have an NABL, they make sure that all of them are being followed to the T. That yes, finally the sample that has gone in. Because if the sample got spoiled in the interim, latest generation machines, they will not even process it. As long as you are a lab that processes the sample.
Yeah. As long as there is it.
And
it's a question of intent.
It was very, very doable to give high quality service. That's not the problem. But that's a concern because I think a lot of users would not understand how the specifics of it work. But the simple also, we also do very regular EQUAS testing where we send out our samples to some of the most reputed labs of the country and we test it ourselves. And it's all NABL, so it's every time it is done, it is documented. It has to be done very regularly. So it will go to NAMs and this and that and all the gold standard. And then we look at the variance of our lab and their lab. Now, all of this is documented by NABL. So it's not just happenstance that I'm saying it doesn't matter. It doesn't matter when you have the systems to make sure that it works nicely. So I think we're fairly good on that.
On this note, we have seen this story playing out in various other industries that if a category leader does bad, either financially or there are controversies around it. Yeah. I have seen that playing out very closely in EdTech when Baiju when kaput, the whole industry was painted with a common brush. Do you think that you guys are facing a lot more flack than you would have otherwise faced because of what the category leader went through last year?
We consider ourselves to be the category leader in the category we operate. But anyway, no, I think it's actually better for the ecosystem if all the key players are doing well in the early parts of the game, because a lot of effort is required to get a category going and user behavior change. As I said, the entire industry, 3 to 4% of the market. It's not fighting for share between each other that will give us success. It is about this industry going up and our fair share is good enough. Having said that, I think the churn in the industry because of specific issues that pharmacy had to go through. I think that did result in a lot of share moving to us. Of course, that's nobody will complain on that account. But in our industry, at least the industry did not shrink too much. And the difference also, I think, might be that in our industry, other than pharmacy, the other players are not really dependent on financial investors. Okay. They're mostly strategics if you look at it. Apollo is just strategically backed. Tata, Reliance, through GeoNet Meds. Now MedPlus has gone IPO, so it's fairly large. And then there were the Flipkarts and the Amazons who are there in the game on the periphery, but they're still there. So we had only one player who was dependent on the financial investors. Unlike other industries where the financial investor signal is all investors kind of follow each other in that sense, we didn't have that kind of a challenge. They're long-term strategic players.
There's also a very interesting trend. So if you look at healthcare, the sentiment in the public market or on the private equity side is extremely positive. Yes. All hospital stocks are seeing a gold rush. And if you look at the venture side, the sentiment is extremely negative. Yes. I mean, no VC would touch a health tech company with a 10-foot pole, early stages.
Right.
How do you reconcile this?
Yeah, no, I think it's real. It's unfortunate that because people need to see success stories. People need to see winners in this ecosystem and some large companies that get formed. I do believe it will change. I think the first part of it validates the interest in healthcare is very, very strong. It's a macro bet for the next 20, 30, 40 years. Healthcare is only going to grow from where we are. What India has an opportunity now is actually to create models for the entire global south, and the government is very keen on working through that, especially the new age models that start playing with data in unique ways. AI work, we believe, is going to pick up pace very, very, very fast in the coming few years. So I do feel the basic plumbing has been put in place. Now, as I said, we built our business on the back of a lot of other e-commerce players who had done the hard work in getting payments in order, getting logistics in order, warehousing in order, user behavior in order. We benefited from that, and
the roads are laid by somebody else.
So we have laid the roads now for a lot of things now, and it really helps actually. That's another important point I should mention. 2010 to 2020, the hospitals were not really getting any money. The private equity interest was almost zero. So hospitals were not flush with capital to actually experiment or work on new digital initiatives. So now that there is so much capital that has come into various parts of the healthcare ecosystem, I think the new players get to play a lot more. It's just that abundance of capital creates that. Sometimes you need that luxury of customers having some money for your business to start making sense. So right now, at least, you're building solutions for all hospitals are looking to digitize. All hospitals are looking to connect better with their consumer. All hospitals are looking for better ERPs. All that technology they are not going to build. Somebody is. Now, whether it is a new age company that figures it out, and as we start seeing that happen, I think we'll see, as I said, healthcare, what the investors also are most worried about is it just takes a lot longer than they anticipate. But there are very clear moves or macro moves to back. And that's where if make in India medical devices, heal in India, heal from India, by India, all these are real government initiatives. They are very keen to put effort behind that. And these things matter but it will still not be like in 1 year companies will go like this. They'll still be building. But 5 years, 10 years from here, you'll see really large companies. That's what I feel.
So patient capital also has to go.
Healthcare has to have its.
वो 6 साल में exit नहीं है यहाँ healthcare में. Okay, let's talk about the artificial intelligence in healthcare. there's a lot of discussion about how it is going to completely reshape how care is delivered.
Yeah.
How much of it is froth? How much of action do you actually see happening on ground?
If you've seen that Gartner curve for any technology, it goes like this is. So this is the hype of inflated expectations. Then it falls into a valley of where everybody gives up on it, and then it comes to a stable plateau. So AI part is at the hype part, but the plateau is very real. It's going to happen. It's going to happen for many reasons. One is it makes sense in healthcare. Now, once you start having enough longitudinal as well as horizontal data of a population set, you start learning and identifying patterns of behavior. You start seeing fundamental changes, and there are too many of them to talk about, but one I had mentioned, just digitizing the prescription, very simple automation kind of space. There's the other part of it, which is look at the doctor-patient relationship. Now, why and how will India manage the doctor-patient deficit that has been talked about for the longest time? And if you look at it from a very theoretical, philosophical perspective, no industry has grown without a fundamental improvement in productivity. Now, here we have an opportunity to have a step change in productivity. I'll tell you how. The doctor-patient conversation for the last 100 years, 200 years, whenever, has been the same. Doctor asks for the symptoms, patients tell what he or she is feeling, doctor then processes it, then the doctor writes some diagnosis and tests or medicines, hands it over to the patient. It takes 5-6 minutes. Now, a large part of that activity can actually be taken over by AI in reasonably good ways. One is ingestion of data. And data is now not just what the patient is telling, it's from your wearables, from your history. All kinds of data is getting collated by a AI agent. The way one of my teammates put it, and I think it makes sense to me, is just imagine like a doctor has a very high quality intern now with him, and that intern, instead of a human, is a machine, is an AI bot. Now that thing gets all the data, does the processing, and has the ability to correlate with all the models available in the world, that with data these could be the possible lines of treatment, and then presents a summary to the doctor where the processing, data input, all those things have been done, leaving the doctor with the key job of finalizing which plan he wants to go with and comforting the patient, and that, yes, do this nicely, you will be fine. Though that's extremely important. If the doctor can do that, they'll have much better customer experience. They'll be able to see a lot more patients. And also then the next part of it is the output. The entire, right now, the patient leaves the doctor's clinic, patient is again on his or her own. After leaving the clinic also, the patient can be put on a long-term plan. How to manage your condition better. At your home, you'll get this, everything managed with the doctor at the center. This doctor becomes a much more powerful doctor that is seeing 10 times more patients at equivalent or better quality. Now, how do you make that doctor that strong? That is where AI comes in. That is where these models come in, and it's real. It's happening, and now we are seeing early stages. Within our company, we are doing a lot of work on data sciences, whether it is disease progression models, whether it is the doctor-patient triaging right now, and whether it is the automation of prescription digitization.
And despite AI and despite all the technology, you still run a very people-intensive org. The therapists, doctors, pharmacists, technicians, phlebotomists. Has this case manpower being a blocker to your growth?
So I think manpower is, I feel, an enabler of our growth. And in our industry, we actually have an opportunity to create a career track for people who have not had a career track. So typically, if you look at phlebotomists, pharmacists, they work at a shop, then they work at another shop, then they work at another shop. Retire ho jate hain as phlebotomist. Why not? If we have 1,000 phlebotomists working, team leaders are also going to be phlebotomists, then their managers are also ideally going to. Right now, it's coming from a separate system, people coming on top, but the good ones here are going to get into that. So for me, again, at 1mg, one of my primary stated objectives is I want 1mg to be the number one place for a frontline healthcare worker to want to work. And we need to create the systems I see it as an opportunity and a business differentiator that I can create that ecosystem where these guys get appreciated, they get a progression track, they get skill development, all the good stuff. So manpower is always a requirement, and I think with AI and all taking jobs from a lot of other sectors, again, the care part and the service part of healthcare will probably one of the last ones to. In fact, the value of those services are only going to go up more and more. So in my mind, I think that's what I tell my teams also, that if you are robotic about your healthcare, then a robot will deliver it for you. But if you are actually genuinely delivering care and empathy, that is the safest job in the world.
This was a great and very insightful discussion, Prashant. Thanks a lot. I just have one last question for you.
Yes.
What would be your advice for people building in India in general, and especially building in healthcare?
I think build for the long term, you don't have an option, to be honest, but you have to have a view that you are building a business that will take 8 to 10 years. It takes compounding. You have to be focused on doing the right thing all the time, because at the end of the day, healthcare is a business of trust. And I have seen enough players go up and flame out through the last 15 years. That's just been all too common. The only players that have sustained, in my experience in healthcare, are players who have been very clear about the lines that they operate in. Very clear that at the end of the day, if they are trusted by their customers, they will have a reason to exist. So to me, that part is non-negotiable. Other than that, I think the other part that people need to be also very clear about is just you have to be patient in this game, like it or not, but have a very good sense of what is controllable and what is not controllable by you at this point in time. Obsess about whatever you can control. There are too many things that affect the outcome of a healthcare company that you actually cannot control. Whether it is the non-market issues, regulators, investors, competition, this, that, many things will happen around you. They will happen whether you like it or not. I think in healthcare, just given so many stakeholders, you get too much noise around you. You need to just zone out of, figure out what can you control. Sometimes you can control a lot of these aspects also, but don't obsess over whatever you can't control. If you're doing the right thing, I've seen slowly but surely things fall in place.
Think long term and don't obsess about things that you can't control. That's a great advice. Thanks, Prashant. We totally enjoyed having you on the show.
It was a pleasure.